Alrighty, let's get this show on the road then. So this morning we are going to be covering emergency hemorrhage control. So we're looking at scenarios where we have an animal with hemorrhage. We'll explain what hemorrhage is and how we're going to control that. So for those of you that haven't already been in talks with me all week, I am Laura Salmond. I have a background predominantly in emergency and critical care. I graduated from University of Queensland with my Bachelor of Applied Science, major in vet tech, back in 2012. And since then, I have been in emergency practice. I've done my diploma in ECC as well as my veterinary technician specialist in ECC. All right, so today we're going to cover what hemorrhage is, how we identify hemorrhage, and how we're going to respond to a hemorrhage situation. So hemorrhage is defined as the loss of blood from the circulatory system. Now this can be major or a minor hemorrhage. It can be internal or external. So internal, it can be into a body cavity, so say the chest or the abdomen, or external where we see a wound on the outside that is bleeding. Situations where we might see an internal bleed are traumas such as hit by a car, tumours that rupture. These are harder to notice and the signs are not as obvious as bleeding on the outside. And then external, we have things like laceration. So dog runs through a window, dog runs into a stick and it gets a laceration, dog attacks, hit by cars, all those sorts of things. Open fractures, any of those sorts of things. When we look at hemorrhage, we can either hemorrhage from the venous system, the arterial system, or have a capillary hemorrhage, which is from the venous system. The different types of hemorrhage is going to change how much bleeding we're going to see and how critical that situation becomes and how quickly. So when we look at arterial versus venous hemorrhage, arterial is the worst case scenario. So these are going to be things, commonly I've seen them with dogs that run into sharp things and they lacerate across the leg and manage to catch the artery. Now the arterial system is a high pressure system. So anytime that there's compromise to the artery, the blood that comes out is going to be under high pressure. That is where we see that spurting. You've probably seen it on Grey's Anatomy or something like that. Someone comes in and there's blood just an arterial bleed is very obvious because the blood coming out will come out hard and fast and it will go everywhere. It will also be bright red because the arterial blood is oxygenated. An arterial bleed can result in large volumes being lost in a short time. Now, when we look at a venous bleed in comparison, these are lower pressure. It doesn't have the full weight of a heart pumping against it. It's heading back to the heart. These bleeds will ooze. They won't spurt out. They'll just sort of trickle, and there may be a lot of blood, but they'll just trickle. And it'll be a darker red color because it's deoxygenated blood. Now with venous, these should be able to clot because of the lower pressure system, unless there is a coagulopathy. And in that case, it's a whole nother kettle of fish and the blood is not able to clot. So it's going to complicate controlling the bleed significantly. So when we are rushing in to help a dog with hemorrhage, we need to be mindful, first and foremost, always about workplace health and safety considerations. We can't help the patient if we are also injured. So we need to make sure that before we run into a situation that we ourselves are safe. Now that includes making sure the environment that the patient is in is not going to harm us. say they've run through a window and they're still sitting surrounded by glass, we need to control that situation before we rush on in there. And we need to be mindful of the risk. It also includes things like planning for aggression that we wouldn't normally see. So these animals may be in pain. Depending on the trauma, there's going to be a lot of adrenaline going through their body and they may react unpredictably. So we need to make sure that we plan for all those scenarios and keep ourselves safe. Ideally, when we are handling any of these patients, we're wearing PPE, such as gloves where possible. If you're, say, at home and it's your own dog, you may not have gloves, but just try and always make sure you keep your hands nice and clean. Get help. Don't try and handle a situation like this on your own. Always find help and always make sure that you are keeping yourself safe. We will go through a demonstration of how to put on a makeshift muzzle at the end. I'm going to do it on my own dog. She's going to be thrilled. All right, so first aid for a hemorrhage. So in this kind of situation, so say you are at the park and you've seen a dog, it's run over something sharp and it is now bleeding from its leg. So we are going to assess the situation. Can we get to the patient safely and can we handle the patient safely? Once we've done that, we're going to identify the type of bleed that we have. Now, ultimately, it doesn't matter. We need to stop it regardless, but knowing whether it's arterial versus venous will guide us on what we do after. If it's an arterial bleed, we need to get in there quicker. We need to stop it, which means if we're not at a vet clinic, we need to find the closest one and we need to get there to deal with that. If it's venous, we've got a little bit more time because we can put some first aid measures in place to try and slow that bleeding down. So we want to check for foreign bodies. So if we're looking for things like glass, sticks, any of those things, depending on how deeply embedded a foreign body is, will determine whether we try and remove that foreign body. If it is embedded quite deeply and is likely already stemming the flow of blood itself, leave it in there. Don't try and pull it out. But if it's just, say, it's just on the surface or it's like the dog's got some sticks and stuff stuck in the blood, remove those so that you're getting as much dirt and stuff out as possible. So we want to try and stop or slow the bleed down. And the way we're going to do that is by applying pressure to try and pinch off either the vein or the artery or multiples that are bleeding. So we can do that with either direct digital pressure. So that is going to be going in with fingers, hand, and applying direct firm pressure over the top of the wound. Now, again, ideally, we would have gloves, we would have a chance to wash our hands, give them a good scrub before we do any of that. But obviously, if you're at the park, you're probably not carrying a full first aid kit with gloves, and you're probably definitely not carrying a sink, but definitely make sure that you do some good hand hygiene after. So then we look at direct pressure. So again, that can be direct digital pressure, or we can look at applying pressure with something like a clean towel, a t-shirt, any of those sorts of things that we can use as a bit of a pad to put over the wound, and then we can apply pressure over the top of that. Pressure wraps. So these are things like bandages, or seen it on TV, they strip off bits of their shirt and tie them around it and pull it tight. Any of those sorts of things, pressure wraps to apply, again, you want to apply pressure to the bleeding. Tourniquets should be used as a last resort. So a tourniquet tends to go at the top of a limb. It will constrict blood flow to the whole limb. So that may, if it's applied incorrectly or left on for too long, may compromise the entire limb. So it should only be applied by a veterinarian or under their instruction, and it shouldn't be left on for long periods of time. Does anyone have any questions up until here?
I do actually, Laura. One thing about like penetrating sticks, so say it was sticking into the thoracic region or something like that. One thing I did see at one point was wrapping a bandage around it like a donut so that it goes around the stick. So that way you're not putting pressure directly on the stick. Is
Yep.
that, yeah?
Yeah, absolutely. So if we have a penetrating foreign body that we are leaving in, we want to support that when we wrap it. So I am going to demonstrate that on my dog with a fake penetrating foreign body. We do want to stabilize that so that it doesn't dislodge or move around whilst we're transporting the patient. The more it moves around, the more damage it's going to do, the more bleeding it's going to cause. But also, if we pull it out, it's probably going to bleed a lot. So yeah, definitely using bandaging material or a towel or something to wrap around the base to keep it still, and then applying another wrap. I'll show you how I would do that, and I'll do it on my own dog. So we'll cover that one in just a minute. Lauren asked, what basics would you recommend having in a first aid kit to keep in the car? This is a really good one. So for my first aid kit in the car, I have bandages, because you're probably going to need them if you're needing to apply a pressure bandage. If you've seen a dog hit by a car, like these are the kind of situations you're going to see where you might need a first aid kit in your car. Where you've seen a dog hit by a car or there's been a dog attack at the park, there's going to be wounds you're probably going to need bandages. So I've got bandages. I have sterile saline if I need to do any flushing. What else have I got? I have leads. I have a couple of muzzles, but I also have like ties in there to do makeshift muzzles if needed for different sizes. I've got clean towels. I've got gloves. Always a good thing to have. Yep, absolutely, gloves. I should have brought it in. I'm trying to think of what else I've got in there. I do have thermal blankets purely because I got a whole bunch of medical stuff donated to me. So I threw some in there just in case. I think that's the bulk of it, I think, is bandages, flush, leads, and muzzles. I think I can't think of anything else off the top of my head. But yeah, there's definitely gloves in there. All right, any other questions before I move on? And then I'm going to get my dog up on a table and see how much she wants to play. She's asleep at the moment, so she may not be keen. All right, bear with me a second. I'm going to wake her up. Let's see how we go. Can you guys see my camera well enough, or do you want me to stop sharing the PowerPoint?
No, that's good.
Yeah, we can see you pretty well.
Sweet. All right.
For those of you who are not tech savvy, you can actually drag the PowerPoint slide across. So if you put your mouse directly in the middle, you can drag it across. That way you can increase the size of the visual screen.
All right, sit.
Thanks, Alana.
No, you're good. Stay there. All right. So here's my patient. This is Misty. She is very used to being subjected to all these sorts of terrible things. All right, so I'm going to apply a makeshift muzzle. So for this, what I've actually grabbed is the rope from a dressing gown. So you can use anything long. So you're going to make a loop. So what I've done there is I've made a loop. I'm then going to pop that over her nose. She's like, no, you're not. I'm going to pop it over her nose. I'm going to wrap it underneath the bottom, bring it back around the top and around the back of her head. Can you guys see this okay?
Yep, sure can. Thanks.
Yep.
Yes.
Cool. and then tie it behind her head. So I have now muzzled. Poor dog. I'm gonna take it off because she doesn't love it. All right, did everyone get those steps? Know how to do that one?
Yep, thank you.
Yep. All right, so let's say she has done something stupid. She's run into a sharp piece of metal and she's bleeding from this leg. So what I'm going to do is I have a bandage here. This is a nice convenient one. It's already got a padding on it, but you could apply sort of any cloth or anything like that to act as a dressing. I'm going to pop that on and I'm going to wrap that firmly around to apply pressure. Now, if this bandage, so say she had an arterial bleed or a heavy venous bleed, if that was the case and this bandage started to strike through, so the blood started to come through because it was soaking that pad or whatever I had there instead, I'm not going to remove this dressing, okay? I'm not going to take this off and put a new one on. I'm just going to keep adding more. I'm going to keep adding more and more layers until I get to a bit and can stop that bleed, okay? If we remove this primary layer, we also remove any chance of a clot forming. So when a clot forms, it's likely to stick to that dressing a little bit. So if I then take this off, what I'm going to do is I'm going to rip that clot straight off. And any control that I've gotten over that bleed is going to be eliminated. So our other options are, again, direct digital pressure. So I might, if she had an open laceration and I could see where the blood was coming from, I might be able to go in there and apply direct firm pressure. Now I want these bandages or whatever I'm using to be firm pressure. I don't want it to cut off circulation to the entire leg. I just want firm pressure over that site. Or we could use a clean tea towel or a clean t-shirt, anything like that, and do exactly the same thing. We could put that over the leg and then we could go and apply a bandage over the top. Now, here's my stick. And this is where we'll talk about the donut bandage. So say she's got a stick in here. I'm going to want to stabilize that stick. So I'm going to roll up a towel. I have a very compliant patient here. They're not always this easy. So my stick's there. I'm going to wrap this around the base of it so that it stays still. And then I'm going to wrap another bandage around the rest of the leg. Trying to keep that as still as possible. So if you've got someone to help you, they can stabilize that while you do this. Poor dog's like, what are you doing to me? Why do I have a stick sticking out of my leg? So you can see there, that stick's not moving. And then it's nice and stable. It's not going to pull out. It's not going to go anywhere. But we also need to then make sure we keep the patient as still as possible. So when we're transporting these guys, if there is, so we want to try and keep whatever, if it's a limb, we want to try and keep it above the heart as much as possible. That's going to decrease the pressure. So when we transport these patients, if we can try and, I don't know if I'm going to be able to flip her on this bench, if we can try and transport them lateral so that this leg is above the heart, it's just going to decrease some of that pressure that's going and help stop some of that bleeding. All right, does anyone want me to show any of those steps again?
I'm good, thanks.
All right, I'm not actually going to wrap her, but if you ever get a penetrating foreign body that is going into the chest, for those ones, a penetrating foreign body into the chest is going to let air in. And that's what we don't want. We don't want the chest filling up with air because then the lungs can't fill up with air. They can't expand properly. So if we ever get a chest wound that manages to go all the way through into the chest cavity itself, we need to make sure that we are controlling the air that's going in. Now, for those guys, we don't use a normal bandage. We wrap them in Glad wrap. So for those ones, it's what we call a sucking chest wound. And every time that patient breathes, it's going to pull air into the thorax, but it's not pulling it into the lungs. It's just going to be pulling it into the pleural space, and that's then going to be limiting the space that the lungs have to expand. So we want to limit that by creating a seal around the chest. So we're going to wrap those guys in Glad wrap because you can pull air through a gauze bandage, but you can't pull it through Glad wrap. I'm not going to do that to her because it's uncomfortable. But we don't want to be too tight because we also don't want to restrict the chest rising and falling. We just want to try and seal that wound. She does deserve a treat, but she'll have to wait. She gets ripped off. She gets TD's treats. So she's just gone back to sleep. She doesn't care. This poor dog has been used for everything, every kind of demonstration you could possibly think of, including CPR. So she's fairly used to it by now. All right. Does anyone have any questions? Anything you want to go back through?
I find that fascinating, the Glad wrap.
Yeah.
Never ever heard of that before in my life.
Yeah, so it's actually a really handy trait, a really handy trick. So, yeah, so definitely you can use other things other than Glad wrap. What you want is an impermeable cover. So you can't use anything that's going to let air travel through it. I generally see sucking chest wounds with pigging dogs. So these dogs go out and get into a tussle with a pig, and they end up with a tusk through the chest, and then they end up with these sucking chest wounds. So a lot of piggers will actually take out their own first aid kits, and their own first aid kits include things like staplers. And you can staple the wound shut. You can try and seal the wound shut back with skin. And even if you can pinch it there in place, if you don't have anything else, pinch it there in place and just try and seal it that way. You're never going to get a perfect seal, but it's better than having a giant open wound that's just sucking air in.
That is also useful for like umbilical hernias that have ruptured or complete eviscerations. I have used it in a calf before where the intestines have been coming out, and it's just you just Glad wrap and then run to the vet.
Yep. Yeah, so certainly if you've got prolapse organs, wrapping them in Glad wrap is another good one, or even just, the aim there is to keep them clean. We had a dog present. It was only a young Kelpie that was a week post being spayed, and they tied her up out the front of the house while they went in to make sure there were no other dogs out because they didn't want her to get too excited. And in the 2 minutes that they were gone, she managed to chew open her spay wound. And then obviously as intestines started coming out, she was like, oh God, what is happening?
It's like a graphic movie.
Yeah, it was pretty gnarly. So she as intestines started coming out, she started panicking and started chewing on them.
Oh God.
So she actually ended up with less than 50 centimeters of gut by the time we removed everything that she'd chewed on. But yeah, those owners were instructed to wrap her in Glad wrap so that we could they could get her to the clinic with as much intestine intact as possible.
She was okay.
Yeah, she surprisingly did really well for a dog with short gut syndrome. She had a very restricted diet, and I don't think she'll ever get very big. But that was 6 years ago, and she's still kicking. She's still doing good. We do cover CPR. I am doing CPR next Friday. I am splitting that into basic and advanced life support. So yes, we will. Adhesives that we could use on the chest cavity to close. If you're in it would depend on how big the wound was, but generally I would say never put anything in a wound without direction. Sometimes some of the things that we could use on wounds will actually delay wound and tissue healing. So it would depend on how big it was. Glue is only good for so much. It can't do a big, if the dog was gored by a pig or something like that, or had a big stick go through, glue is not going to close that kind of wound. Again, packing the wound, if you try and pack a chest wound, you're likely to push them in further than you like. Yeah, exactly. So yeah, we could be leaving stuff in there. Yeah, same with a leg wound, packing a leg wound or something like that that's bleeding. You can with, so that's your pressure. So if the wound is quite deep, then the only way to get pressure in there might be to pack that wound with swabs or towel or bandaging or whatever you've got on you. So definitely you can pack wounds that are bleeding. I wouldn't pack a chest wound though, so much. All right, any other questions coming through? All right. Well, if there's no other questions, we might offer internal hemorrhages. A lot harder. There's not a lot you can do in an emergency situation unless you're in a clinic about internal hemorrhage. Aside from keeping the patient as still and calm as possible, there's not a lot you can do. The only way to control an internal hemorrhage is to stop the bleed from the inside. So that might mean surgery, that might mean there are drugs that we use to promote clotting. So those sorts of things. Some internal hemorrhages will clot by themselves and stop by themselves. If you've got say a splenic tumor that has ruptured, sometimes they'll stop by themselves, they'll clot, and then they'll be okay for a little while until the next time that it happens. But internal hemorrhages is not really one that you can try and control in the field. You just have to keep them as calm and still as possible and get them to a vet as quickly as possible. Ooh, external signs of an internal hemorrhage. So for these, if you see a dog get hit by a car, there is always going to be the likelihood that they are going to have some kind of internal bleeding. But signs of internal bleeding, things like your gums going pale, signs of shock or collapse, you might notice that if it's an abdominal bleed, they'll start to look a little bloated depending on how big the bleed is. There's only so much room in the abdomen. So if it starts to fill up with blood, you might notice that. So in their chest, if that starts to fill up with blood, you might notice things like they're struggling to breathe. What else? It's really hard to detect them from the outside. You're going to be looking for those pale gums that are going to indicate blood loss, pulses that might indicate they're losing a lot of blood. So if their pulses don't feel quite right, increase respiration rate. So as they start getting hypervolemic, they'll try to offset the lack of oxygen being transported around the body by increasing their respiration rate. Coming out of ears, nose, or mouth, it would depend on the type of trauma. If the bleed is into the chest, they may cough up, depending on whether it's like within the lung or external to the lung, they may cough up blood. But if it's external to the lung, so between the lung and the wall of the chest, then no, you won't see that through blood coming out of anywhere else. If it's in the abdomen, again, you won't see it. If you're seeing blood come out of ears, nose, or mouth, you're potentially looking at a coagulopathy anyway, unless it's an upper airway trauma. What happens when you get to the clinic with an arterial hemorrhage? They're going to run that animal out the back, and they're going to try and stop that as quickly as possible. So that may be going in to a surgical procedure straight away to try and do that. They may ligate the vessel, so very quickly, either with clamps or a suture. They may wrap that around the end of the vessel to tie it off. And then, depending on how much blood the patient's lost, they'll get them into surgery to fix up the wound, and then potentially start giving them a blood transfusion to replace some of that blood that's been lost. But essentially, once you get to clinic with an arterial hemorrhage, they're going to run real quick, which is why it's good if you can identify it before you get there. That way they don't even have to take the bandage off to work it out themselves before they start knowing what to do. Oof. Prolat's eyes are disgusting, right? So there's one here about a cat with the eye hanging completely out. These owners generally ring distraught. They are very difficult. It is such an alarming thing to see with an animal with an eye hanging out. Yeah. For these, there is not much they can do. They can wet down a clean towel and put it over the eye, but they just need to get to the clinic as quickly as possible. Anything like that is like up the top in the list of emergencies. So it's time is of the essence to save the eye, but applying just a wet towel over it can just help prevent that drying out, and prevent the patient doing more trauma by scratching it. Obviously that's going to hurt, it's going to be uncomfortable, and an animal's first instinct is going to be, what is this? What is happening? So preventing that that self-trauma from making it worse. Oh, a chest infection after losing her eye. Well, that's an interesting one. No, I don't. No, that's an interesting one. Did you speak to the vets about that? Do they have any ideas about what it might have been? Oh, guinea pigs are such fragile creatures. Such fragile creatures. Same as rabbits. Sorry to hear. All right. Any other last questions coming through?
How about, Laura, like a reptile? Procedures are still the same?
Oh, you guys are into the tricky questions today. I actually don't know. I have never seen a reptile bleed. I don't know, I'm sorry. That is one that we might have to ask Shonnet about. Maybe if you jump in next week, I know they're doing an open Q&A. So maybe write all your questions down that you have that we can't answer in the meantime, and jump in and ask them then.
Yeah, perfect. Only 'cause last week I saw something on the side of the road and thought, oh, you know, what could have been done to save it? And it was already gone. Yeah, it was open, not to the point that you would assume that it would have died, but it was certainly run over by a car at some point. And I thought, oh, what would you do? You know?
Yeah. I don't know. I'm not great with the reptiles. It's certainly not my area, but maybe, yeah, save your questions up and ask Shona next week. I know they're doing an open Q&A for any sort of out there questions. I think that's a good one for her. Protruding bones and fractures. Reptiles are definitely more fragile. Yeah, that much I know. Protruding bones. So again, we want to try with fractures. We want to try and control the bleeding, but obviously moving around a fracture is going to hurt a lot. So if we can keep So if you can apply a pressure bandage without moving the leg around too much, that's great. And again, same principle, you just want to try and stabilize it. You just want to try and stop those bones moving around. The pain in fractures comes from bones grating on each other, tearing at the tissue and those sorts of things. So the aim is to immobilize the limb and immobilize the bones from shifting around. Ugh, I don't want to think about that. Gross. Broken bones, like, ugh. I was a surgery nurse and I did not enjoy orthopedics. It didn't go well. But yeah, you definitely just want to try and stabilize it and try and control any bleeding that you can.